Hi, my name is Heidi Galar Sargudo, and today's topic is a randomized trial of beva for newly diagnosed glioblastoma. Definition: bevacizumab, a humanized monoclonal antibody against vascular endothelial growth factor A, is currently approved for recurrent glioblastoma.
As a tumor grows beyond 1 to 2 millimeters, its need for oxygen and other nutrients begins to exceed the local blood supply. Starved for nourishment, the tumor turns on the angiogenic switch. This change marks a critical moment in tumor development, as it provides the tumor with the blood supply needed not only to survive, but to thrive. Under these highly volatile conditions, the growing vasculature fuels tumor growth and opens up new routes for tumor metastasis. The key mediator of this process of angiogenesis is vascular endothelial growth factor, or VEGF. When VEGF binds to receptors on the surface of endothelial cells, it has been shown to exert important effects. These multiple roles of VEGF, promoting tumor vessel survival, increasing tumor vessel permeability, and stimulating new tumor vessel growth, are important throughout tumor development and make VEGF an attractive therapeutic target. First and foremost, VEGF is a potent stimulator of new tumor vessel growth, capable of inducing new vascular sprouting within 1 day. These new vessels continually provide increased access to oxygen and other vital nutrients that fuel tumor growth. Due largely to VEGF, tumor vasculature is also highly abnormal. Tumor vessels are marked by many endothelial fenestrations and open gaps between endothelial cells. These abnormalities promote the leakage of plasma proteins, resulting in high pressure within the tumor that may restrict anti-cancer drug delivery. Many therapeutic strategies for targeting the VEGF pathway are currently under investigation. Primary among them is Avastin, a humanized monoclonal antibody to VEGF. By directly inhibiting VEGF, Avastin may have multiple effects on tumor vasculature, including regression of existing vessels, normalization of surviving vessels, and inhibition of new and recurrent vessel growth. It has been proposed that these effects begin early and continue throughout treatment.
Application in medicine. So it's important to know if bevacizumab will improve survival among patients with newly diagnosed glioblastoma.
We are here in Chicago at the ASCO annual meeting 2013 with Dr. Matthias Preusser from Vienna, Austria. And we would like him to talk to us a little bit about the recent results that were presented here in brain tumors.
Okay, well, we had a very interesting ASCO from the perspective of brain tumor research. We saw interesting data on glioblastoma. Glioblastoma is the most common brain tumor in adults, primary brain tumor in adults. It's a tumor which has a median overall survival of about 14 months. So it's a devastating disease, and we are desperately in need of better treatments. One of the main focus of brain tumor research in the current time is anti-angiogenesis, because glioblastoma is characterized by a lot of microvascular proliferation in the tumor and expression of VEGF-A. And so what was done now is to test the drug bevacizumab, which is an anti-VEGF antibody in this disease, and we saw several trial results here at ASCO. One large trial performed by the RTOG, it's called RTOG 0825, randomized about 900 patients. One treatment arm received a standard chemo radiotherapy after resection, and the other arm received the same treatment plus the antibody.
Let's continue. Pros and cons. Pros: concurrent treatment with temozolomide and radiotherapy, followed by maintenance. Temozolomide is the standard of care for patients with newly diagnosed glioblastoma. On the other hand, the cons are that there were modest increases in rates of hypertension, thromboembolic events, intestinal perforation, and neutropenia in the patients treated with bevacizumab.
The study was a multicentric randomized phase 3 placebo-controlled study which was done in patients with the locally advanced relapsed cervical cancer. And in this study there were two objectives. The first one was to assess the role of a combination chemotherapy not including cisplatin but another chemotherapeutic agents. And the second objective was to assess the role of bevacizumab in combination with chemotherapy to see whether by adding an anti-angiogenic compound it would be possible to increase the survival of those patients. And clearly the endpoint, the main endpoint of the study was an improvement of the overall survival. And this is a particularly relevant question because in the last 10 years there have been a plateau of the results achieved in this particular patient overall survival of about 12 months. And the data which were presented focused only on the comparison between adding bevacizumab to combination chemotherapy. What was really relevant is that in this study it was shown that by adding bevacizumab to the standard combination, which is today cisplatin and paclitaxel, it's possible to increase the overall survival by a period of 4 months. And that's relevant results because also it's in agreement with an increase of the overall response rate as well as an increase of the progression-free survival. And what is also relevant is that the toxicity was acceptable in this treatment and there was some anti-tumor effect also in the field of radiation, which is very difficult site of getting results.
And the disease. Glioblastoma is the most common primary malignant brain tumor in adults. Location. Glioblastomas are generally found in the cerebral hemispheres of the brain, but can be found anywhere in the brain or spinal cord. Symptoms. Because glioblastomas can grow rapidly, the most common symptoms are usually caused by increased pressure in the brain. These symptoms can include headache, nausea, vomiting, and drowsiness. Depending on the location of the tumor, patients can develop a variety of symptoms such as weakness on the side of the body, memory and/or speech difficulties, and visual changes.
This was Christmas Eve '06. I was filling out my insurance forms and the doctor came out the door and said, "Follow me." And I said, "Well, I haven't finished the forms yet." And he said, "We can wait, follow me." I went into the back room and he said, "That's it." And he went like this. "Half your brain is cancer." And the next thing I knew, I was here with Dr. Baskin.
So Matthew's case was extraordinarily interesting and challenging. Here's a bright young man managing a trust for his family, his whole life ahead of him, with a tumor right in the primary speech and language area of the brain. If we go in and take out too much, he'll never talk again.
When the ambulance pulled up at the hospital, they took me to intensive care unit. And that's when Dr. Baskin asked if I would be willing to join a special program. And I said, yes, I want to be part of the special program if that program can help me to survive. But not only that, but to help others to survive. And if what you learn from me can help even one other person in the world, I want to be part of this program. The morning of my surgery, my mom came in my room to wake me up to get ready to go to the hospital. And my dad was just behind her and standing in the door of my room. I wanted to compliment my mom and dad for my life because I didn't know if I was going to be coming out of surgery alive or not. Dr. Baskin took 60% of my cancer out, left 40% in. He took part of my brain so that my cancer had an area to heal.
Gliomas are primary brain tumors that arise within the brain itself. We don't know the cell of origin for these types of tumors, but they all probably come from one or two different types of cells within the brain. There are multiple grades of brain tumors, grades 2, 3, and 4. There are some very rare familial syndromes that are associated with brain tumors, but the only known risk factor that we have for brain tumors is radiation exposure.
So thank you very much for watching.